Good morning, everybody. Let me present my PhD work, which is entitled Differentiation of Childhood Epileptic Seizures and Paroxysmal Non-Epileptic Events based on Video Electroencephalogram Monitoring. I am Tímea Lőrincz-Molnár, a pediatrician resident doctor from the Bethesda Children's Hospital and a PhD student interested in pediatric neurology. My aim is to help children and their families dealing with neurological disorders while improving the diagnosis of paroxysmal events in childhood. Therefore, we are investigating the characteristics and differences of paroxysmal non-epileptic events and epileptic seizures in childhood based on Video-EEG monitoring. We are conducting two studies having the same clinical question, employing the same PECO question framework, but we perform two distinct scientific methodologies. First, a systematic review and a meta-analysis, and after that, a registry analysis. Let me start with my first project, which will offer a new perspective into pediatric neurology. So the most frequent neurological condition in the pediatric population is epilepsy, affecting approximately 1% of the pediatric population. But nearly half of patients with paroxysmal non-epileptic events are misdiagnosed. These are episodes that resemble epileptic seizures, but do not involve abnormal electrical activity in the brain. The consequences of misdiagnosis are crucial. First, in case of overdiagnosis, children will face social stigma. They will have lowered educational expectations, then can have constraints in their daily life. For example, they are not allowed to swim or to get a driving license. They may suffer from complications of the anti-epileptic treatment, which can range from toxic dermatological reaction to even suicidal thoughts. And finally, the diagnosis and treatment of this condition, it's a huge financial burden nationwide. Contrary, if underdiagnosis occurs, there is still an untreated underlying condition in case of the children, which can be life-threatening, such as a heart arrhythmia, and in more severe cases, children can experience prolonged seizures with vital instability. And sadly, the diagnostic delay can exceed beyond 20 years, potentially endangering the patient's life. And how can we diagnose these conditions? So the routine diagnostic method consists of patient history taking, neurological examination, accessing the home videos where parents recorded the suspected event, and the electroencephalogram. But due to the lack of differential diagnostic protocols, the misdiagnosis is common. The gold standard is the VEEG, which is a long-term continuous monitoring. But the access to it is limited as it requires special equipment and medical expertise, only available in epilepsy centers. Therefore, our aim is to identify the main characteristics of PNE, which can serve as a guiding framework while the neurological examination and while accessing the home videos. To achieve our mission, we have to answer the next question. What are the VEEG and patient history data differences between the two entities? Therefore, we are investigating children with paroxysmal events. The exposure is epilepsy, the comparator is PNE, and we access the patient data and VEEG characteristics. We suppose that there are notable differences between the two entities. With our project, we have four main objectives. First, medical experts will get a definitive diagnostic framework. Secondly, patients will gain proper diagnosis and medical care. Thirdly, families can benefit from diminished disease burden. And finally, policymakers can have a reduced financial burden. So we did a systematic search. Our search key is composed of three main domains, focusing on the pediatric population, the VEEG, and epilepsy or paroxysmal events. And while accessing three main databases, we had more than 11,000 articles. During the literature review, it became evident that the main limitation is the absence of direct comparative studies between the two entities. Therefore, we relied on the individual studies. The key articles showed us that there are articles with numerous events recorded, characterized by internationally validated classification system, and focusing on the age dependency of these conditions. But there are limited data about neonates and infants, and in most of the studies, the individual number of events are not correlated to the patient number, therefore offering bias. So after the systematic search, after the duplicate removal, we could eliminate more than 3,000 articles, and now after the title and approx selection, we have nearly 400 articles. Finally, you can see the progress of my first project. And for a better characterization of these events, we are conducting a registry analysis using our Epilepsy Center's Video-EEG registry. So, the Bethesda Children's Hospital Video-EEG monitoring unit was established in 2001, where children and their families are offered continuous video monitorization by medical expertise. Within the last years, there were more than 1,500 recordings with the aim of diagnosis, differential diagnosis, and pre-surgical assessment of the children. Our aim is to compare the characteristics of Tímea and epileptic seizures in order to highlight the main differences for a better differential diagnostic protocol. So the data from the last 22 years is collected and validated by 3 epileptic neurologists, 1 PhD and 1 project student. Into our registry, we are including patients who underwent VEEG and experienced at least 1 epileptic or paroxysmal non-epileptic events, and we are excluding patients without events or with concomitant episodes. So in our registry, in case of the 1,030 epileptic patients, there are more than 36,000 records, and in case of children with paroxysmal non-epileptic episodes, in case of the 350 patients, we have more than 8,500 recordings, making our pediatric VEEG registry one of the largest and most detailed about its kind. So in order to characterize the paroxysmal events in the pediatric population, we are performing the last 2 before mentioned studies. And finally, I would like to reflect on Nobel laureate May-Britt Moser's words about her success. The secret is that I have never stopped being a child. Thank you for your attention.
Congratulations. This was a nice presentation.
Thank you.
The first question is mine. What does it mean, PNA? For example, only a myoclonus or other form of non-epileptic events?
Thank you for your attention. It's a really critical question in our project. So the paroxysmal non-epileptic events are a huge variety of manifestations, which can be even motor or psychogenic symptoms, a tic or a psychogenic non-epileptic episodes with a complex manifestation variance. But using the EEG recording, there are no abnormal activity in the brain, and it offers a great confusion during the diagnostic.
Okay, thank you. I ask the audience, any questions?
Thank you for the presentation. My question is about your second project. So I'm not sure I understood correctly. So is your project about preparing sort of a data set for later registry analysis or actual analysis of the registry? And if it's the second, do you have any specific analysis plan or is it yet to come? Thank you.
So I'm in an honored position because the registry, the data is collected. So our epilepsy center has the before mentioned events recorded and collected. And our plan is to further characterize these events by adding the semiological aspects into the database. And after that, we would like to make an analysis based on the semiological aspects of the episode using the video recordings and EEG recordings too. And in both in case of Tímea and epilepsy, and therefore we would like to compare the characteristics of it.
Okay, thank you.
So thank you for a nice presentation. My question would be, why do you have limited video EEG data on infants and little children?
Thank you for your question. So we are interested in neonatal recordings too, but the neonatal EEG is a subfield of the pediatric epileptology and requires special knowledge and experience, as the neonates and young infants have undeveloped neurological pathways which offer different electrical signs which would be abnormal in adult population or infants. And as the neural pathways develop, as evolves the EEG pattern of the children too.
Thank you.
Any more question? Yes.
Thank you for your nice presentation. I'm just wondering, for how long do you monitor patients?
Thank you for your question. It's a great question. So the length of the monitoring is really individual. We have to focus on the patient and the aim of the recording. So for example, in a routine EEG recording, it can last minutes or even an hour, but in case of a pre-surgical assessment or an epilepsy characterization, it can last even 1 week, more days, because we have to define the exact anatomical origin of the epileptic focus and the main characteristics of the epileptic episodes too.
Okay, thank you. Last short question and short answer.
Thank you. So I have a question related to your first project. You mentioned anti-epileptics could cause suicidal thoughts as a side effect. What do you think is the direct effect of the anti-epileptics, or because these patients are more likely to develop comorbid psychiatric symptoms or diseases? I'm asking it because we use in psychiatry anti-epileptics to treat bipolar disorder and to prevent mood swings, depressive episodes, and manic episodes also.
Thank you. It's a great question. So first, I think that due to the manipulation in the neurotransmitters, it can have a direct effect. But as you mentioned before, the neurological patients have also psychiatric comorbidities, which can cause higher prevalence of these signs.